We are one of the largest headache practices in the Midwest.
We have three goals at institute level: patient care, education, and research.
Headaches are something that afflicts people in younger age groups particularly, and these are people that are in their most productive years of their lives, and ones where they're very busy. Many people, if you have kids and so forth, you might be missing social events, you might not make your child's basketball game, you might miss work. So it's a disease that, particularly when it becomes more frequent, that can have an enormous impact on the lives of patients.
We are very proud to offer all the procedural care, and when I say procedure, which include Botox injections for chronic migraine, we do nerve blocks for that. Then we offer IV infusion treatments for people who are in acute headache when the headache is lasting at severe level more than 3 days. So those people, sometimes they don't respond to oral medications, so we are offering them IV infusion treatments to break those cycles. So I think if you look at the whole spectrum of care, starting from ambulatory to procedures to infusions, we are able to offer everything what any other health center in the country can offer.
I think we're doing a lot of different innovations. The research that we have involving weather and migraine is extremely unique, and there's not many centers that are actually looking at that particular area. In the headache field, I think we're known as the leading headache referral source, certainly within the greater Cincinnati area, mostly through our ability to take care of the whole patient at more of a holistic type of an approach.
If somebody is coming to us, it's already serious enough. Nobody walks in with a simpler headache. Typically, they will treat with over-the-counter medication. So that's one thing we take very seriously. And then at the same time, we meet them where they are. Like, we try to individualize their care, even though there are certain general rules we follow, certain principles we follow in headache medicine, but everybody's goals and needs and situations are different, so we need to match it there. And I think we intentionally do effort to do that.
I think philanthropy has made a big difference in care. So we've got a number of different projects that we've been working on, and I think they're rather unique when compared to other headache clinics across the country. One is we have a primary care program where we've gone into primary care practices here at UC Health, and we're trying to educate primary care physicians on migraine. We're trying to develop electronic medical record tools to help them and also develop performance standards. And then there's a research component that we've been involved with as well. And I think we've done some pioneering research on how female hormones trigger migraines. So we've got the educational, and then we've got the research, and then there's clinical care. Ways that philanthropy could impact that could be, we've got a number of different programs, basically support groups to help people manage their migraines. It's basically patient-centered learning. So educational initiatives like that, supporting that can make an enormous difference in our headache clinic.
There is always opportunity for us to expand on what we are able to do, and sometimes that is limited by the resources we have. So I think philanthropy plays a huge role if we can get that support. Thank you, donors. Remember, this makes a huge difference for us to deliver the world-class care we want to deliver to our patients and community.
I also want to thank all the patients that come into our headache clinic, because we've learned from you, much like you have learned from us. And it's been a true pleasure to take care of you and hopefully have helped you during your migraine journey.